Hello, my name is Savannah Peters. I'm a family nurse practitioner student, and today I will be assessing the head, ears, eyes, nose, throat, skin, hair, and nails through inspection, palpation, and auscultation. Chris is my patient here. Chris, are you comfortable right now?
Yeah, feel good.
Okay, perfect. Then we're going to get started. Okay, so on inspection of his skin color is normal for his race and ethnicity. It is uniform and symmetrical. It looks like he has good hygiene. I do not smell any odor on him. Looks like he takes care of his skin. I do not see any pigmentation, any open lesions. And he does have some freckles, but it looks like there's normal distribution of his freckles. On palpation of his skin, it does feel a little bit on the drier side, but it is warm to the touch. Texture is slightly rough. And then assessing for his skin turgor or elasticity, pinching underneath the collarbone, he has good skin turgor and good elasticity. Turning over his hands, I did notice a few calluses here. And what are these from, Chris?
Lifting weights.
Okay, all right, perfect. That was seen on the palm of his hands. Moving on to his hair, looking at his hair, it is curly, short, it is thick and coarse. It looks like it is normally distributed. I do not see any hair loss or balding, and it is black hair. Moving on to palpation of the scalp. Feeling his scalp, I do not feel any sores, any lesions present. His hair is even in texture. Looks like he takes proper hygiene of his hair. It is clean and well kept. Moving on to his nails, and normally I would assess his fingernails and his toenails. Before this video, I will just be doing his fingernails. Can I have your hand? Thank you. So looking at his fingernails, they are smooth and round with its edges. It looks like they're clipped and short as well. The cuticles are smooth. I do not see any cracks or cuts in his cuticles. His nail plate has uniform thickness. It is firm and smooth. Each nail is attached to the nail bed. I do not note any clubbing. And then pressing on his nail bed, I'm going to assess for capillary refill. Perfect. Okay, his capillary refill is less than 3 seconds. Moving on to his head and face. So upon inspection of his scalp and his skull, it looks like they are normal cephalic. I do not see any asymmetry, trauma, or lesions noted. Can you look at me? Perfect. Okay, looking at me, his face is symmetrical. I do not see any scarring or lesions on his face. I do not see any irregular pigmentation to his face. And I do not see any facial tics. I do not see any crushing of his eyelids or eyebrows. Upon palpation of his skull, I do not feel any sunken fontanelles. And then I'm going to check his frontal and maxillary sinuses. Do you feel any pressure or tenderness here?
No.
Okay, that was the frontal sinuses. Now the maxillary sinuses. Any pressure?
No.
Tenderness here. Okay. Now I'm going to assess his mastoid process. Any pressure, tenderness here?
No.
Okay, perfect. Okay. Moving on, I'm going to assess his neck. Upon inspection of his neck, if you could look directly at me. Okay, this is symmetrical. The neck is full. I will assess range of motion in a second. Looking at his trachea, I do not see any bulges. I do not see any protrusions noted. Can you turn your head right and left for me? Perfect. So he has full range of motion. Okay, and I did not see any protrusions of his trachea when he was doing that. Upon inspection of his neck, again, I do not see any webbing, skin folds. I do not see any masses present. Upon palpation of his trachea, I do not feel any bulges, any enlargement. Is there any tenderness when I'm pressing?
No.
Okay. Moving on to assessment of the thyroid gland. I'm going to start at his chin. I'm going to go midway down, mid part of his neck. Okay. Upon inspection of the thyroid, I do not see any enlargement. I do not see any bulging of his thyroid. I'm going to come behind him now to assess the thyroid. Okay. Upon palpation, thyroid is small and soft. Is there any tenderness when I do this?
No.
Perfect. Okay. I'm going to have you take a sip of water. Perfect. Okay. Thyroid gland is symmetrical. He has proper movement of his hyoid bone and his cartilages. Was there any pain or tenderness when I pressed on your thyroid gland?
No.
Okay. Moving on to the lymph nodes, I will be inspecting first. So looking at the lymph nodes, I do not see any redness. I do not see any bulging. I'm going to go through each lymph node. Let me know if you have any tenderness while I'm palpating. First, doing the preocular. Any tenderness?
No.
Postocular?
No.
Okay. Submandibular?
No.
Okay. Submantle?
No.
Okay. Occipital?
No.
Okay. Then we have the sternocleidomastoid muscle, and that's where the deep cervical lymph nodes are. So I'm going to feel there.
Nope.
Any tenderness? Perfect. And the posterior cervical lymph nodes?
No.
Okay. Last but not least, we have the supraclavicular lymph nodes.
No.
Great. Okay, I'm going to palpate your temporomandibular joint now. Go ahead and open and close your mouth. Perfect. Okay, no crepitus was noted. And then I'm going to auscultate your temporal arteries above your eyes and your thyroid gland on the right and left side. So auscultating your thyroid gland, I'm using the bell side of my stethoscope. Auscultating your temporal arteries. And above your eyes. Perfect. No breweries were heard. Moving on to the eyes, I'm going to assess his peripheral vision first. So I'm going to have you look directly at me, okay? And then let me know when you can see my finger.
Yep.
Okay.
Yep.
Perfect. Peripheral vision is intact. No deficits noted. Now I'm going to assess his visual acuity. Normally I would be 20 feet back, but for the purposes of this video, I will be close up. Go ahead and cover one of your eyes and read the lowest line that you can.
LTPH.
Okay? I'm going to switch.
LTPH.
Perfect. Patient has 20/20 vision. He does wear contacts. Moving on to the inspection, his eyebrows are symmetrical. The texture of his hair is the same on both sides. Pulling down his lower eyelids, I'm going to assess his conjunctiva and sclera. They are white in color. I do not see any discharge, any jaundice. The lacrimal glands have no redness or swelling. I do not note any pterygum, and his orbital area does not have any edema or lesions present. Moving on to his eyelids, I do not see any redness. I do not see any tremors. I do not see any flakiness, any fasciculation, any swelling or ptosis of his eyelids. Getting out my pen light, I'm just going to look in both of his eyes. Okay, perfect. I do not see any foreign objects in his eyes. The eye color is the same on both the right and left eyes. Corneas are clear with no arcus. Now checking his pupils. Go ahead and look directly at me. Okay, pupils are 3 millimeters. They're equal, round, and reactive to the light. Did the light bother you at all?
No.
Okay. No light sensitivity noted. Checking your pupillary reflex, go ahead and look directly at me. I'm going to hold this light here. Okay, perfect. So pupillary reflex is intact in response to light and accommodation. I did not notice any afferent pupillary defects or nystagmus. Putting my pen light down, I'm going to now check his extraocular muscles using the 6 cardinal views of gaze test. So I'm going to have you look directly at me. Okay, and I'm going to have you follow my finger, okay, just with your eyes. Perfect. Okay, now look directly at me as I bring my finger closer to you. Okay, perfect. So his extraocular muscles are intact, his eyes follow, and they converge and constrict. Moving on to the cover-uncover test, this is checking for cross-eye or strabismus. Go ahead and cover one of your eyes for me. So I'm looking to see if one of his eyes goes towards his nose. Okay, go ahead and switch for me. Okay, perfect. And no cross-eye was noted. Now I'm going to get up my ophthalmoscope. Turning the light on. I'm holding the ophthalmoscope in the same eye that I am assessing. So ophthalmoscope is in my right eye. I'm looking at the patient's right eye. I do not see red reflex. Moving in, looking at his retina, optic disc, lens. Okay, macula. Switching sides. Now I'm holding the ophthalmoscope in my left eye, looking at his left eye. Red reflex is present, looking at his retina, optic disc, macula. Perfect. So for both his right and left eyes, the retina was red-orange, no lesions noted. His lenses were clear. I was able to visualize his blood vessels. I did not see any AV nicking or cotton wool spots. His optic discs were round with sharp margins. His macula was yellow oval, and his depth of anterior chamber was present. Moving on to his ears. Looking at his ears, his auricles and mastoid areas are symmetrical. His ears are in the same his ears are in the same position, size and shape. His external ears, I do not see any drainage. I'm just going to palpate his ears now. Okay, pulling on his ears, on his lobes and his pinna. I do not feel any nodules. Do you have any tenderness or pain when I'm doing this?
No.
Okay, perfect. So now I'm going to get out my otoscope. I also did not notice any swelling, rashes, or lesions when looking at his ears. So I'm turning the light on. I'm going to hold my otoscope upside down, and then because he is an adult, I'm going to lift his ear up and back and looking in his inner ear. Okay. I'm going to look in his other ear. Perfect. So I did not notice any foreign bodies, any discharge, any lesions. His tympanic membrane is white. I do not see any perforations there. I was able to visualize his bony prominences, and the light reflex was present in his ears bilaterally. Now going to assess his auditory system. We're going to start with the whisper test. So I'm going to have you plug your right ear, stand a little bit away, repeat the word that I say to you. Baseball.
Baseball.
Perfect. Go ahead and switch sides.
Sunshine.
Perfect. He passed his whisper test. He can hear low level sounds. Moving on to the Weber test, I have my tuning fork here. Okay. I'm going to put this on your forehead and let me know when you can't feel the vibration anymore.
Can't feel it.
Okay, perfect. So he passed his Weber test. He has no unilateral hearing loss. Moving on to the Rhine test. I am going to put the tuning fork behind his mastoid process and then over his ear. I'm going to ask you a couple questions while I do this. Okay, let me know when you can't hear it anymore.
Can't hear it. Can't hear it.
Okay, and then the same thing with the right ear.
Can't hear it. Can't hear it.
Okay, perfect. He passed the Rhine test, and that proves that he has no hearing loss. And just an important side note that air conduction is 2 times longer than bone conduction, and that is also proved with this Rhine test. Moving on to his nose. Upon inspection of his nose, I do not see any rashes, no swelling. His nose is medium in size and brown in color. Upon palpation of his nose, I do not feel any displacement of his cartilage, no masses present. Using an otoscope, I am going to look in his nostrils, pushing the bridge of his nose up, looking in. Perfect. Looking in his left nostril and his right nostril. I did not notice any deviated septums, no narrowing, discharge, or swelling of his turbinates, and his nostrils were pink in color. Palpating his frontal sinuses below his eyebrows with my thumbs going up and in. Any pain or tenderness?
No.
Feeling his maxillary sinuses. Any pain or tenderness?
No.
Good. Now I'm going to percuss his frontal sinuses above his eyebrows. Any pain or tenderness?
No.
And his cheeks?
No.
Any pain or tenderness? Perfect. Moving on to his throat, inspecting his mouth, I do not see any cracks. I do not see any sores or herpetic lesions. Lips are symmetrical and pink, and I do not see any edema to his lips. Go ahead and open your mouth and just show me your teeth. Perfect. So teeth are white in color. I do not see any loose teeth. Gums are pink and moist. Moving on, I'm going to look at his buccal mucosa. Go ahead and open up wide. Okay, perfect. I do not see any ulcers or spots. Now give me a big ah.
Ah.
Perfect. So I do not see any deviation in his tongue. No tremors noted. No swelling or ulcers. Tongue is pink in color. Looking at the back of his throat, go ahead and open up again for me. Okay, his uvula is midline. His palate is also midline. I did not see any swelling at his posterior wall of pharynx. And his tonsillar pillars are not swollen as well, and his tonsils are still intact. Lastly, I would normally palpate his tongue and buccal mucosa for lumps, nodules, or ulcers. Ask him if he has any tenderness, but I will not be doing that in this video. And that concludes the head, ears, eyes, nose, throat, hair, skin, and nails assessment. Chris, thank you so much for your time.